Welcome to this week's Health and Care Update on the coronavirus pandemic in Devon. While cases here in Devon are falling over recent weeks, we are now seeing that decrease has started to slow down. I'd like to hand over now to Simon Chant, who will give you more information about the data in Devon.
This is an overview of the latest national and local data on COVID-19 as of Thursday, the 4th of March. We start with the national picture. Cases continue to fall nationally, but are above the levels seen in summer and early autumn. The number of tests and testing capacity remains high, and deaths continue to fall. Now for the local picture. In Devon, for the latest available week, there were 223 COVID-19 cases and 10 deaths, with rates of both below the national average. Case rates are slightly higher in eastern Devon. Cases of COVID-19 are continuing to fall in Devon, although the rate of decrease is slowed. Case rates are slightly higher in those aged 18 over and those aged 20 to 59. The data in the summary is drawn from Devon's COVID-19 dashboard and the National Coronavirus Tracker, where the latest available information can be found.
Thanks, Simon. The first step in the government's roadmap starts next week, with all students returning to schools and colleges. Students are going to be asked to take a lateral flow test twice a week, and while it's not mandatory, I really encourage all parents to consent for their children to be tested twice a week. Testing students will enable us to identify those who have no symptoms but are infectious, and so they can isolate immediately, as can their households. This will allow us to break that chain of transmission. If we don't do this, then there is a risk that COVID will be transmitted unknowingly within the school. I would also encourage all parents of pupils in secondary school, primary school, colleges, and indeed nurseries to get a test twice a week as well. You can get more information on how to get a test if you go to devon.gov.uk/testing. As restrictions do start to lift, it's so important that we continue to follow the national lockdown measures and stay at home and only go out if it's absolutely essential. If you do go out, remember, wear your face mask when you're in a public place indoors, keep social distance from one another, and wash your hands regularly. I'd now like to hand over to Dr. Paul Johnson from NHS Devon CCG.
The number of coronavirus cases and patients in hospital with the virus continues to fall, which is positive news, and thanks to everyone for following the national guidelines. As a result, the government 4 tests for cautiously easing lockdown restrictions are currently being met, so the first step will proceed from Monday the 8th of March. This will see the reopening of schools, while 2 people from different households will be able to meet outside and 1 nominated person can visit a care home. While restrictions will be eased slightly, it's important to continue to stay home as much as possible and only leave for work if you can't work from home, to take your child to school, for essential shopping, exercise, or medical appointments. More than 400,000 people have now received a first dose of the vaccine. That's a third of our population. This is an incredible achievement in a little over 3 months, and I'd like to thank the health and care staff, volunteers, and everyone else who's helped make this happen. This week, Priority Group 7, people aged 60 to 64, are now starting to be invited for their vaccination. It's not too late to book an appointment if you're in any of the earlier groups, if you're aged 65 or above, or with long-term conditions. So please do come forward. If you've received a letter from the National Booking System inviting you to book an appointment, either use the NHS website or call 119. There are several vaccination locations available in Devon via the booking service, including the large vaccination centres in Exeter and Plymouth, as well as community pharmacies. Appointments are regularly added, so if there aren't any available, keep checking the website over the coming days. Please don't contact your GP practice about a vaccination, as it prevents people who need medical help getting through to the practice and slows down the vaccination programme. So our message to you: while it is good news that restrictions will be lifted slightly, it's also a critical time, as the virus is still as deadly as ever and spreads very easily. With spring around the corner and the weather getting warmer, it is tempting to want to make the most of Devon's idyllic scenery, including the local beaches, the moors and other public spaces. But I urge you to continue to be careful and only go out if you absolutely need to. Everyone has a role to play in protecting each other and getting us back to normal. So please continue to stay at home as much as you can and only leave if it's essential.